So one of the considerations with endovascular aortic repair is the radiation exposure and the contrast dose that's given to the patient during these procedures. Fusion imaging has been shown to reduce both the amount of radiation and the amount of contrast that the patient is exposed to in endovascular aortic repair. So we use fusion imaging for all our aortic intervention, including complex procedures using branch and fenestrated stent grafts and infrarenal endovascular aortic repair. I think that machine learning and artificial intelligence lends itself very, very well to image analysis, and therefore to leverage the advances in these techniques is an obvious implementation for fusion imaging. We use this system developed by Sidar Medical, which uses very powerful cloud computing to process preoperative CT scan images. And part of that processing involves using intelligent algorithms to deform and adjust this preoperative CT so that once it's overlaid onto the intraoperative fluoroscopy, it has millimeter accuracy. And the beauty of this technique is that it's all done in an automated fashion. So it doesn't need any manual registering by the operator, which means that it happens automatically, it's easy to use, and therefore that means the operator is more likely to use it and reap the benefits of lower radiation exposure and lower contrast use during the aortic intervention. I think we are just starting to see the influences that AI will have in vascular surgery. As far as my specific practice is concerned, I perform branched and fenestrated endografting, and I think that artificial intelligence will help us predict anatomy once the stent graft is introduced into the patient, will help us plan our complex stent grafts better, and perhaps it will help us select the patients where procedures will run smoothly and where repairing the aneurysm is indicated. Therefore, it will be one of the options we use to select whether the patient merits intervention. And I think there are various advantages that this technology will bring, and we will see these in the coming years. Again, I think it will come down to prediction. I think at the moment we use relatively small data sets in order to look for trends, look at predicting outcomes, look at predicting anatomy. The promise that AI brings is analyzing large data sets in an automated fashion and looking for patterns, and that will lend itself to various aspects of our practice as vascular surgeons. If you think about the aortic interventions, its image guidance is predicting deformation of the anatomy intraoperatively. It's predicting how a stent graft may sit once it's inside the aorta. But if you look at other aspects of vascular surgery, for example, predicting how a patient will tolerate an anesthetic, a long procedure, predicting longevity, how long the patient will live, how likely the patient is to develop complications. These are all, if you like, pattern recognition systems that AI will be able to perform very well using large data sets. So I'm excited about what AI may bring for the future.